Welcome to Iceland Virtual 2021.
About thread. Yeah, it's really an honor to us to have you here join with us. Okay, so before Dr. Hosung Choi start the presentation, I will read briefly his CV. So for Dr. Hosung Choi from South Korea, as education from March 1992 to February 1998, graduation of Yonsei Medical College from Seoul, Korea. And then work experience from July 2014 until present in Vienna Aesthetic Clinic, cosmetic surgeon as the chief director. Activities for Dr. Hosung Choi as a chief board member of Korean Aesthetic Surgery and Laser Society, as chief board member of Korean Academy of Facelifting and Contouring, as global key doctor of Mers Aesthetic for product Radius Belotero Ultra P, and then global key doctor of Sinclair Pharma, and then global training instructor of LG Chem, Y Solution, global training instructor of pharma research product Rejuran and Claviel, also as clinical training instructor of Exo Cobio. Okay, for everybody, all participants, if you want to give questions to Dr. Hosung Choi, you can write down in the question box and we will discuss after the presentation of Dr. Hosung Choi. Okay, for Dr. Hosung Choi, the time is yours.
Thank you. Hello, everyone. This is Dr. Hosung Choi. I'm a cosmetic surgeon from South Korea. Today, I'm going to talk about how to produce natural effect using various floating PDO threads. Let's start. For the past 10 years, I've been participating as a consultant and training instructor of various filler injection and thread lifting for all around the world. First of all, let's have a look at the classification of PDO thread, the basic classification. PDO thread can be divided into non-barbed and barbed type. And non-barbed type PDO thread can be divided into monofilaments and multi-thread type. And cog thread can be divided into various types of depending on the manufacturing method and the shape of the cog. Now in Korea, there are so many types of cog PDO thread, and they have all different shapes of cog or different in thickness of the thread. And also there are sharp needle and blunt cannula. You can choose one of them for the purpose of the treatment. According to a recent study, 90% of physicians are unhappy with the quality of thread, PDO thread used for thread lifting. It is due to an early breakage of the thread after the procedure, resulting in a rapid relapse or breaking easily in the process of storing the thread. However, Crocky, the thread product which is the topic of the today, is the most fundamental and well-made PDO thread made by Samyang Company. Samyang has been professionally researching and developing raw materials for PDO sutures since long time ago. So about 80% of all PDO threads on the global market are made from raw materials supplied by Samyang. In 5-year stimulation test, the same conditions as the 15-day stimulation test at 90 degrees Celsius, Crookie's tensile strength has remained almost unchanged, while other companies' products have significantly lost their tensile strength. And barb holding strength of Crookie from the same stimulation test also remained almost unchanged, unlike other products, regardless of the type of cork. As the results of this stress test show, Crookie has an excellent durability. Crookie's barb holding strength is well managed by a high quality assurance system from Samyang Company. As a result, Crookie has an outstanding durability. If properly stored in a room temperature, for example, the quality of Crookie will be maintained for more than 3 years. So in practice, I think I'm using many types of PDO threads from many other different companies. But usually, when I keep the products for more than 6 months in my operation room, usually there is some early breakage of the thread. So sometimes I'm really embarrassed during the procedure. However, why I really trust Crocky products is because of its durability. It has a really different durability from other products. It has outstanding durability. So if you use this product and if you keep more than 1 year, for example, and you will see the same durability as the first time you purchase it. Let me introduce 2 representative products of Crocky. The first one is a screw type thread. It is a coil type PDO monofilament that is mainly used for the skin tightening. And the other one is barb cutting PDO thread, which is a floating type cork thread used to reposition the soft tissue. As I mentioned before, a Crocky cork thread has a strong tissue anchoring power that enables a secure tissue repositioning. It is connected to a sharp needle or cannula. You can choose depending on the purpose of your treatment. And it has a variety of thickness and length products. Now let's move on the insertion technique. There are the basic pattern design for each part of the face. The design for the mid and lower face, and for the upper face or brow lifting, including submental area and the jawline lifting. Let's find out the basic pattern design for mid and lower face lifting more in detail. At the point where the line A and B meet the hairline, which are the yellow points, there are entry points for lower and mid face. And thread insertion from these 2 entry points to lower and mid face can provide an effective lifting. Basically, it is not necessary to insert the threads beyond these lines C and D, because a sufficient lifting effect can be achieved even if the end of the thread is not located more medial or more lower than these two lines. Because if you put too medially, for example, from here to there, because this part, patients are moving their muscles always. So there may be some side effects, such as a protruding thread and unnatural smile. So it's better to advance your thread up to these two lines. An additional thread insertion from tragus to jowl fat pad is useful for more effective jowl lifting for older patients. And when using this vector, thread can be inserted beyond the vertical line. But I would recommend not to cross the Marriott line or melometal fold. So I think it's better to put threads up to or just in front of this line. Will be much safer. Reverse thread insertion technique is a method of inserting the thread in a direction opposite to the usual direction, from the lower part to upper part, or from the medial part to lateral part. This technique is useful when the basic method alone lacks lifting effects or providing a more definite lifting effect to the patient after a single treatment. So when you fail to achieve a good result by first session, if you want to do a touch-up or second session, then if you use this technique, you can be assured that the second session will provide a better effect. When combining these two methods at the same time, the usual direction and reverse direction, a much more powerful lifting effect could be achieved by enlarged skin surface for anchoring the tissue. However, a long downtime will be needed because there will be a little more swelling. Now let's have a look at a short video about the lower face lifting using various speeder threads. First, I checked the tissue mobility and asymmetry, and I should usually the routine is I draw two lines. They were line C and D, and I choose the area to be treated, to be lifted. And usually the entry points are made by these two lines and the crossing line with the hairline. And the upper entry point will be used for lifting for the lower face, and the lower one will be used for the mid-face lifting. And on one more entry point, just in front of tragus for the jowl lifting. And you can put more threads more in horizontal direction if the patient has a jawline distortion or a too definite obvious Marriott line. But for younger patients, you only need to make 2 entry points. That's enough. And before inserting the thread, pinch the skin symmetrically. It's very important. And then if you penetrate the thread, the dermis, and then you should advance almost in 0 degree. That means very horizontally and almost parallel to the skin surface. And this area, usually there is a thick retaining ligament, which is zygomatico-cutaneous ligament. And when passing this ligament, you should advance your cannula a little lower than other pathway, because if the thread is located too superficially, then after lifting, this sunken may look worse. So to prevent the sunken of the lateral cheek, you may keep your cannula parallel to the skin surface. So where the skin is bulged, you advance a little shallower, and where there is a sunken area, you should advance the cannula a little bit lower, a little bit deeper. But do not penetrate or touch the SMAS. A severe bleeding may happen. And after removing the cannula, I usually tie 2 nuts using 2 threads. So before tying, put more threads as the design. The rule is not crossing the thread, not crossing this line, but a little crossing, 1 or 2 centimeters crossing the line. It's okay, but do not advance too much. And once you put all the threads, if you lift the thread, then you will see the skin lifted very uniformly. And 2 of them, I'm tying 2 knots. You should tie very tightly, because if the knots are released after, the patients can touch the end of the thread on the entry point. And cut the remaining threads as close as skin possible. And after cutting, or after cutting the remaining thread, there could be some tension or dimple on the entry point, but it's very easy to release it, because you only have to pull the skin in the opposite direction from the thread inserted. And this is entry point in front of the tragus to lift the jowl. And there is a parotid gland, as we all know. So you should keep the thread very superficially. Very close to the dermis. Don't go deeper. And when lifting the jowl, you can advance up to the fold, but do not cross the fold. And then tie again. This direction is very useful when lifting jowl, and there will be 2 vectors for jowl lifting, and eventually the jowl fat will be effectively lifted. Okay, I'm just pulling the skin gently, not too strongly. And this is temporal lifting to reinforce the lower face lifting, because for Asians, many Asians have already projected zygoma. So lifting only in the same direction or in the same area may cause some bulging or widening of the zygoma. So I prefer to use both technique, or sometimes I use only temporal lifting. For those who have already too widened cheekbone, or if this area is too thick, or there's too much fibrotic changes inside the skin, sometimes it's very difficult to advance the thread in the proper layer. Then I can use for the alternative treatment method. For this area, I do not tie basically, because you don't need to tie, because there may be some strong fixing points in the temporal fascia. So usually the lifting power or anchoring power is very strong, and it's better to use a shorter one than usual, around 60 millimeter length, and a little thinner, 20 or 30 PDO thread. I sometimes use only 3, but usually I put more than 5 or sometimes 10 PDO threads per side. And then there will be a strong grasping power of the temple, and eventually the low face will be well lifted. This is 1 month after. Actually, her sagging was not severe in the beginning, but I think the result is quite excellent. And now let's have a look at the eyebrow lift and mid-face contouring as a new strategy for lifting, thread lifting. I think these methods are a little advanced methods, but I will just introduce them. First, eyebrow lift. Before performing eyebrow lift, the vectors should be determined depending on the purpose of treatment or the expectation of the patient. The most commonly used method to determine correct vectors is to find the most efficient pulling point. Usually, the pulling point is located lateral part of the eyebrow, and you can check it by holding up the eyebrow with a fingertip, which is called Flowers maneuver. When lifting the forehead, inserting the thread downward from the hairline is difficult to sustain the effect for a long time. This is because the length of the thread being inserted is shorter because, of course, the length is only 6 to 7 centimeters from the hairline to eyebrow. And therefore, I would recommend to perform reverse insertion technique using thinner and shorter bidirectional cork thread and a sharp needle. If you are expert, you can use a sharp needle rather than blunt cannula because they can provide a more secure fixation because it can fix the thread into the periosteum around here. But there could be some bleeding and hematoma, and you can prevent it by injecting epinephrine before inserting the thread. Okay, this is a supraorbital anatomy. Usually, the fat layer, the target fat layer is the subcutaneous fat layer. Looking at the cadaver dissection, the superficial fat compartments where the threads are inserted and pulled are usually this area, supraorbital compartment, and also temple compartment. So this part are usually the target fat layer. However, when roof is retroorbicularis oculi fat, which is a part of deep fat layer. So if this deep fat is pulled together, the eyebrow will be lifted more effectively. So if the cork thread is inserted in a reverse direction at the level of the eyebrow here, I prefer to make an entry point just beneath the eyebrow or lower margin of the eyebrow. And roof and subcutaneous fat layer together will be lifted, resulting in a more effective brow lift. So around the entry point, you should go a little deeper. And after passing the eyebrow, you should keep the cannula more superficially, I mean above the muscle, so or just beneath the dermis. And then when the full cannula is inserted, try to fix into the periosteum the end of the thread. Even if you use a blunt cannula, you can at some degree at certain degree, you can fix the thread into the periosteum. Maybe not the periosteum, maybe some into the fascia. Anyway, you can, if you can make more or less a strong fixing point, the lifting effect will be more effective and will last longer, this area. And it is similar to the movement of the body by this fitness equipment. If you know about this equipment, when we pull this handle, and you can go, your body will move up like in this direction. So this part will be the moving point, will be the eyebrow, and the fixing point will be the periosteum. So I'm explaining that why reverse insertion technique is useful when lifting eyebrows. So this is my technique. Entry points close to the lower lateral border of eyebrow here, 6 to sometimes 8, but I mostly use 5 to 6 threads. I usually use the croquis with blunt cannula, 20 gauge cannula with 60 millimeter length, and I put, if I want more effective lifting results, I put an additional thread which are connected to sharp needle, 21 gauge 60 millimeters. But before inserting this sharp needle, you should always inject enough tumescent containing epinephrine. And after 15 minutes, there is only a minor bleeding. And to reinforce this lateral part lifting, lateral part of eyebrow lifting, I sometimes use temporal lifting, because temporal lifting can also help to lift mid and lower face together. And for older patients, usually the upper eyelid, there is some ptosis on the upper eyelid. So putting coiled monothread 203 just above the eyebrow, that will make a skin tightening of this area. And then this brow lifting effect will be reinforced by inserting this coiled monothreads. To achieve better results of eyebrow lifting, I often use botulinum toxin injection just beneath the lateral part of the eyebrow. I usually inject only 1 or 2 units for one side. Because this part, there is a upper lateral part of the orbicularis oculi muscle. So if you relax it, because this muscle usually acts as a eyebrow depressor. So if you relax this muscle, the eyebrow will be uplifted. And also, I usually use HIFU because it can correct brow ptosis. And also, if the patient has an obvious temple hollow, then temple augmentation using filler injection will be also helpful to achieve more effective brow lift. Now let's move on the last part, mid-face contouring. As we all know, Oji curve is a kind of S-line that is on one of the criteria for checking cheek fullness, which is also useful as a tool for communicating with the patients. As shown in these pictures, OG curve is more pronounced after improving mid-cheek fullness. The basic insertion depths of the cog, as I already mentioned during the video playing, please check before starting treatment if the patient has very thick and tight retained ligaments. So if sometimes there is already sunken cheek due to too tight retained ligaments, you should inform your patients about this presence of sunken cheek, because it may not be corrected after lifting. or sometimes it may look a little worse than before. So to prevent to make worse of this sunken cheek, the thread should be located a little deeper. Parallel to the skin surface. So if you keep this rule, the result will be much better. And also, many young Asians have more pronounced lateral part of the cheek because of the high cheekbone. So this direction, using this vector may make a more widened cheekbone after the lifting. So you should be very careful not to use this direction. And if you treat patients who have a wide cheekbone, I would recommend to use more vertical direction. So to use this direction, it's quite difficult when you want to begin from the hairline. So I would rather recommend to use this thick anatomical structure. It's located 2 centimeters lateral to the lateral of the canthus, and put two shorter bidirectional cork threads, and then if you tie them up at this area, you can create a very strong lifting effect without widening of the zygoma. So one will be passed more superficially, and one can go deeper. This time I can advance my thread deeper than the smas. And then there will be an effect of the pinching, the smas, like this, after tying 2 knots. So maybe next time, if I have an opportunity to speak, I will select this topic for you. Since the medial thread, temporal lifting method, as I already mentioned, is another useful way to prevent the widening of cheekbones while providing effective lifting effect. So this part I will skip because I already mentioned. Depending on the age and facial skin condition and skeletal shape of this patient to be treated, you should be able to choose the most appropriate design for thread lifting. And also you should consider about the budget of the patient. And then more customized treatments results will be achieved eventually. I'll show you some before and after photo before wrapping up my lecture. Her mid and lower facial contour became more lifted and smoother after perio thread insertion. And she was in her late 20s, quite young patient, but had less defined jawline. So I put some pediococ threads in this direction. After jawline lifting, she has a well-defined jawline with the improvement of skin quality. And these are before and 1 month after photo. There is a noticeable eyebrow lifting result, and lateral canthus is obvious lifted as well. And even 3 months after treatment, the lifting effect of her eyebrows is well maintained, thanks to the reverse direction technique. And this lady had a thread lifting procedure based on a design like this. I put this in this direction for mid-facial lifting, and also I lifted her eyebrows. And after treatment, her facial contour has changed much more nicely, and her eyebrows and upper eyelids are well lifted. Therefore, for some cases, we should consider about additional lifting for the mid-face and lower face to achieve better brow lifting effect. So do not see only a part of the treatment. You should see the whole face because you should keep the balance even after a focal treatment. So this is my conclusion. Video thread can plays an important role in contouring the face, and customized therapeutic approach is very important. And combined use of various types of video threads can facilitate more natural results. And use highly qualified video threads to provide a better predictability and longevity. Why combine use of multiple threads? While you can make only delicious food with good ingredients, you can prepare an excellent meal by combining good ingredients properly. So why not using various type of video threads together at the same time? Okay, that's it for my lecture today. Thank you for listening my presentation.
Okay. Thank you very much, Dr. Hosung Choi. What a nice presentation, what an amazing result. So after this, we can take a look at the question box. I'm still waiting for the participants. To all doctors, you can write down your questions in the question box, and I will read it, and then Dr. Hosung Choi will answer your questions. While we're waiting, I would like to ask about temple lifting, Dr. Hosung Choi.
Yes.
In your presentation, you give the temple lifting. If we do the temple lifting, maybe 3 or 5 pieces
Mhm.
of thread, shall we do it together, doing also the thread towards the downward depth?
Mhm. Yeah.
Can we do it alone, or we have to combine it?
Uh, of course, it's better to combine them because when we put the thread from here to there, the distance, the surface covering is quite small. But if you put a few more threads to this direction up to there, then the treatment result will be much better because you are using larger surface of the face. And
Okay.
also, as we all know that the bidirectional coax thread is not, frankly speaking, is not lifting, it's repositioning or pinching the
Okay.
skin. So if you put too much thread here, there may be a bulging in the middle. So if you put also the temporal lifting, then you will have some effect of sharing of pinching like this. So the result will be more natural, more effective, and more natural by combining two methods.
Okay. What about the anesthesia before we do the temple lifting? Do we have
Mhm.
to do tumescent, or what do we use for the anesthesia?
Actually, if you put the threads in a proper layer, which is subcutaneous layer, so it's quite superficial. But here, as we all know, that the superficial fat is quite thin or almost no superficial fat here. So during advancing the cannula, patient will be suffer from the pain by scratching the dermis. So I would recommend to put at least a small amount of tumescent, about 2 or 3 ml. It will be enough for one side before inserting the thread, especially for older patients because they have almost no fat. So the proper layer is very thin. So it's difficult to advance the cannula without any damaging to the tissue. And also there could be some bleeding and a little hematoma after inserting. So to prevent this hematoma, I recommend to put at least a small amount of tumescent before
Okay.
insertion. Mhm.
Okay. Thank you, Dr. Hosung Choi. And then now talking about the thread, what kind of thread do you suggest or do you recommend that we should use for, yeah, this one is floating thread, yeah.
Mhm.
What kind of thread? Because some patients complaining about migration.
Mhm.
So we have to prevent this
Mhm.
happens. So please
Yes.
explain.
Yes. Since floating threads are not fixed to some area, so it's floating. as we already mentioned. So it has some limitation of the durability. So I think tying two threads on the entry point will make an artificial fixing point, and at least the migration will be much reduced. And also, if the thread is broken, uh, the lower part can migrate to um, to around the perioral area, so the thread can bulge the skin. So patient may complain about it. So this breakage of the thread you can prevent by putting more threads or by using more high quality PDO threads. There are so many types of PDO threads, but most of them are not that strong. When especially when I keep these products more than 3 months, I should worried about the breakage during the insertion or after a few months of insertion. So if you want to be sure that the defect will last longer, then use high quality product like Crocky. So put more threads than usual or select the high quality PDO threads. My answers.
Okay,
Mhm.
thank you, Dr. Hosung Choi. Now we've got questions from the audience.
Mhm.
The first question is from Dr. Maria. Um, Doc, could you please show us how to examine the retaining zygoma ligaments? So
Mhm.
examine the retaining
Okay,
ligament.
I'll show you using my face. So everyone has a zygomatic ligament here. Actually, some papers are demonstrating that the ligament is only a small part, but actually there are extensions. So medial extension and lateral extensions. So uh, we can check it before starting the treatment. If you pull the skin in the lower part, I mean downward, the skin will not move because of the strong ligaments. But I don't have uh, an obvious sunken cheek, but some patients have very prominent sunken area, if you, especially when you pull down the skin. And then you should show the sunken cheek by pulling the skin to your patient, and you should inform them about their presence of the sunken cheek, and you should inform that it's difficult to fix it completely, and sometimes it may look worse. So if you can, but I'll try my best, but sometimes it's difficult. So after informing about this side effect, then patient will be less complaining. Mhm. And
Okay.
or if you see too tight ligaments, then I think choose another direction like temporal lifting, which will not cross these ligaments. So there's a alternative way to more to provide safer treatment.
Okay,
Mhm.
Dr. Hosung Choi.
Mhm.
Then, if we talk about sunken cheek, yeah,
Mhm.
you mentioned that it's really difficult to do correction, yeah, perfectly for the sunken cheek. Is
Mhm.
it better if we choose a filler for patients with
Mhm.
this kind of case? What do you think,
Yes, of
doctors?
course. Yeah, very good question. Because in practice, it's very difficult to reject the patient.
Yes.
So I should find the best way to treat. So sometimes the first thing is I put a little more amount of tumescent, and during injecting tumescent, I a little dissect the ligament.
Yes.
Of course, I cannot completely separate or cut the ligaments, but I try to make a little room, more room for
To release.
yes, to release, and then I can more easily put the thread.
Yes.
Or if the sunken cheek is already present before treatment, I put some filler before. It should be before, prior to thread insertion, because after thread insertion, if you put cannula to insert filler, inject filler, then the threads may lose the tension. So I inject the filler first, but less volume than usual, because I will lift this part and I will reposition at some degree. So I should feel about 70% only, because I'm not injecting only the filler. So I put first 50 to 70% of volume loss, and then I put the thread to reposition this part to fill the sunken area. And then the filler can act as a tumescent, and it can release the ligaments, and the thread will be more easily inserted.
Okay, okay. Thank you very much for your explanation.
You're
We've
welcome.
got another question. Now it's from Dr. Yanvi. Dr. Choi, I still don't understand about the knot technique. May I ask you to explain this more detail, please, Dr. Choi?
Okay. If you use too thick thread, like 10 or 00, it's very difficult to tie. So if you should use very thick thread, I would recommend not to tie them. But if you use thinner than 20 or 30, it becomes easier to tie them up. So whether using a thick thread without tying, or using thinner and short threads with tying, it's up to you to choose. Anyway, uh, to tie them up, you should use at least 20 thickness, thinner than 20,
Okay,
and then tie two times. Only one time usually it doesn't work. So
okay,
two times of tie will be efficient, but three times sometimes it makes too prominent knot,
okay.
and sometimes patient can touch the knot
Yes.
underneath the skin.
Yeah.
So I think two times is the best way, and also it should tie very tightly. Do not tie very released.
Okay.
The tie should be very tight, and then after cutting, before cutting, you should pull the two threads. There will be probably some dimple here, because the thread are pulled too much.
Okay.
And after cutting, the skin will be pulled, and the knot position will be a little beyond the entry point, and
Okay.
these dimples will be released.
Okay. Yep.
Mhm.
Dr. Choi, if there
Yes.
is dimple after the thread, do
Mhm.
we have to give some, yeah, a little bit massage, or we leave it just like that and we will explain to
Mhm.
patients that after a few days it will
Mhm.
disappear? What about
Mhm.
this?
Uh, Usually, there's no need to fix all small dimples on the treated area. But if there is a strong dimple, I mean, strong dimple means if you can see without moving using expression muscles. If you see a prominent dimple, then it's better to release it before finishing the treatment. To release the dimple, usually I use keep the entry point. I mean, the pull the entry point. If you pull the entry point, you will see a more definite dimple.
Okay.
So where the skin where there is a dimple, you pull in the opposite direction, and then one or two cogs which have very high tension will be released. Or you can use your fingers and inside the oral cavity,
Yep.
and you push together, you pinch the skin and pull down.
Pull down.
Then most dimple, even if they are too severe dimples, they will be released. But
Okay.
if there's a very, very small dimple and you can hardly see the dimple only with the light, then I don't think it's necessary to release them because
Okay.
they will be released anyway within 1 or 2 weeks.
Okay, thank you.
Mhm,
Now, questions from Dr. Maria Angelina. Dr. Choi, you mentioned in class all of the technique. These are for women. Now, what about for men if they want to get facelifting? Now, we're talking about men
mhm,
facelifting. Please explain,
mhm.
Dr. Choi.
Yes, of course, some men want to lift their face, but basically, men have thicker skin, and they have usually less sagging than women at the same in the same age. So I think more than 55% of thread lifting patients are women, but 3 to 5% are men. But among men, if patients have very thick skin and very little sagging only, then I don't use thread lifting. I recommend HIFU rather than thread lifting. Uh, but if patients have very thin skin and very old age, usually more than 60 in their age, they will have very thin skin, and the lifting effect will be more or less good. So I make a very strict indications when treating men. Mm, Not all men who want to be lifted using thread. I don't agree, but some of them are good indications. So it's very important to select the good patients, appropriate
Okay.
patients.
Yes. Okay. Thank you. Now we've got another questions now from
Mhm,
Dr. Manalu. What is the difference between using thread with and without a reverse thread? Um,
mhm,
will the reverse thread extend the effect? Could you
mhm.
please explain about this?
Can you repeat one more time?
So
I
this one
couldn't
is
hear.
this question is about reverse thread. So your
Mhm,
technique you mentioned about reverse thread.
mhm,
Is this technique with reverse thread can extend the effect of thread for lifting
mm.
effect? Could you please
Uh-huh.
explain this?
Yes, yes, of course. Because I don't want to recommend to use only the reverse thread because reverse thread technique, insertion technique, is a supportive technique. So first, we should lift for the basic pattern design, and after that, uh, for those who are not expected to have a good result, I always put into the reverse direction. So reverse direction technique is very powerful lifting effect, but it's always a supportive method. Not You should not perform alone. So that's the important point. And also, when we do reverse insertion technique, it's usually provides not only better effect but also more longer lasting effect. That's why it's very useful.
Okay, okay, thank you. Now we've got question from Dr. Ubeta. Why
Mhm,
don't you use a long anchorage thread that she means 40 centimeters with
mhm,
temporal 40
mhm.
millimeters maybe with temporal fascia as the anchoring point to lift?
Yes, I sometimes use, but uh, in the past I used to use a lot because it can provide a really a strong effect and it lasts quite long. Uh, but side effects are also frequent. Most patients are complaining about the pain, the prolonged pain in the temporal area because the fascia is stuck with the thread.
Okay.
So the more we put the tension, the more patient will suffer from the pain. So these days, most patients want a very short downtime, and even if they should get treatment every 6 months or at least 1 year, they prefer to get safer and treatment with low downtime. This is the Korean trend, maybe. Anyway, so I these days I use a more simpler method and method with causing less problem and less discomfort. So this is the Korean trend, or maybe this is the world trend. But sometimes, if the patients are very old, and sometimes a patient need surgical facelift, then I try to put longer pedio threads, starting from the temporal fascia.
Okay. Dr. Choi, is that means that if we use the technique of reverse thread, this might give more comfortable for the patient after the thread insertion if we compare with using the
Mhm.
anchorage thread. Is that right?
Uh, I think uh, not really, because in the aspect of comfort, patient will have more discomfort when using both threads. Of course, because
Okay.
the thread insertion plane are larger than only this direction. So patient will feel a little pain around here, but uh, I think the result itself is really natural.
Okay.
And patients are usually they want more natural results and also effective results, and then they can ignore some discomfort. So they usually want more effective and more natural results. So that's why I use reverse insertion technique.
Okay, one more question. This is
Mhm,
maybe for the last question.
mhm,
Now, you mentioned about the brow lift
mhm,
that we put some thread at the lateral part of the eyebrow.
yes. Mhm,
Could you please explain once again about the technique? Where is the
okay.
insertion point?
Mhm,
You mentioned in your presentations at the
mhm.
brow and then up to where is the insertion point?
Okay, the insertion point is first just the beneath, I mean the lower margin of the lateral eyebrow. So
Okay.
usually the eyebrow thickness is around 2 centimeters, or sometimes thicker than 2 centimeters. But anyway, so the lower part is here, and from the mid pupillary line, I usually put the lateral part from the mid pupillary line. So if you make zero point 0.5 centimeters between two thread entry points, then you can put around six thread until the tail of the eyebrow. So insert the thread from the lower margin of the eyebrow. And first you go a little deeper, but I don't mean you touch the bone, but if you pinch the eyebrow, you can go a little deeper in the beginning. And after crossing the eyebrow, then you should advance your cannula much more superficially,
Okay.
just beneath the dermis. And as this is convex area, so it's very difficult to advance easily, softly. So you should bend the cannula. The cannula can be bended.
Mhm.
So using the other hand, you push the tip of the cannula not to penetrate the dermis. So you should
Okay.
go up to the hairline a little more, cross the hairline, and then your cannula will be stuck at the end.
Okay.
So there is a fixing point.
Okay.
Mhm.
Okay. So the end of the thread is above the hairline. Yeah.
Yes, that's right.
Okay. Yeah. If okay. So if we do the brow lift,
Mhm.
how long will it last? The lifting effect for brow, how long will it last?
Using more than 20 threads, using the reverse direction technique, I think it can last up to 1 year, but maybe in between 6 months and 1 year, around 8 months to 10 months.
Okay.
It's quite excellent longevity, because usually when we put like this, uh, I can expect only 2 or 3 months.
Okay. Okay, thank you very much, Dr.
You're
Hosung
welcome.
Choi. We've
Mhm,
got a lot of discussion about that, and this is very
mhm,
interesting.
mhm.
Thanks again. For the closing, could you please give some take-home message for all the doctors, for all the participants, please?
Yes, I think thread insertion is one of the most challenging and very interesting treatment modality. And I think in the future, the thread insertion technique will be more advanced. So if there is a chance of speaking in this meeting, I will prepare a more interesting and advanced contents. And also, I really hope this pandemic will end soon, and then we can meet offline.
Yes, thank you
Stay,
very much. Yeah.
stay
Okay.
healthy and stay safe.
Yeah, you too, Dr. Hosung Choi. Thank you very much. Success always for Dr. Hosung Choi. Stay
Mhm.
safe and stay healthy. To all participants, thank you. This is the end of Dr. Hosung Choi, but we will still have another speaker after this. So stay tuned in a virtual ISWAM. We'll meet you after this. Okay. Thank you, Dr. Hosung
Thank
Choi.
you. Bye bye.
Bye. Hello, everybody. We meet again. Still in the session 17th of Virtual ISWAM today. Uh, yeah. So today we're still talking about thread and beginner to expertise. For the next speaker, we'll talk about the thread lift of 101, beginner to expertise. And we will meet again with Dr. Lan Leong Chung. He's already with us. Let's greet Dr. Lan. Good afternoon, Dr. Lan. How are you today?
I'm fine. I'm fine. Thanks for joining us again.
Yes, thank you very much. Join us again in Virtual ISWAM. So this afternoon you will talk about thread. Yeah, so we're talking about thread lift 101, and everybody is waiting for your class about this thread. Before you start your presentation, may I briefly read your CV again? Dr. Lan Yong Chung from Malaysia. He has been our speakers in last ISWAM in Indonesia. So Dr. Lan is the managing director of global group of companies, also as medical director and founder of Clinic Central, as the key opinion leader for advanced thread lifting, also as the key opinion leader for Helen and Alganese injectable fillers. So to Dr. Lan Yongchung, the time is yours.
Thank you. Thank you. So today's topic a bit why broad topic we need to cover. So the thread lift 101. So I think I'm not going to touch much of the practical parts. So the major things that we are sorry. Can I share? Yeah. So before that, what you need to know when you want to become a very successful facial threads practitioner in this challenging aesthetic industry. So today, my topic, I'm going to touch all the basic things, what you should know and what you should do, and then what you should avoid, and not the practical parts. Okay. So the topic I'm going to touch is a market trend. What the market trend of these aesthetic facial threads, and also how do we classify the different type of the facial threads, and how we do the consultation and do the marketing part, and during the procedure, what the procedure we need to avoid, and what is the dangerous things we shouldn't do during that, And then what complication or side effect we are most common facing during the whole procedure. All these things I'm going to touch in this short 30 minutes. And also I touch a bit of the what is an advanced combination we can combine these facial threads with all various aesthetic procedure. Okay, if you look at the market trend nowadays, I would say the facial threads is started with a minor, it can be doing under the minor procedure. I'm sure the all worldwide, a lot of the beautician is started to do these facial threads. Of course, they are not supposed to do that. But if you look at since a beautician is doing, why not we doctor, you need to actually upgrade ourselves. So the good things for the facial threads, we can practice as a minor procedure. We can do it as a more slightly more complex, which needs a medical doctor to do that. Or even you can upgrade yourself to do a major threads procedure. So all this, if you're doing as under the major, so you need a special trained doctor or plastic surgeon to do that. So in about 8 years ago, this Korean thread monofilament was introduced to our Malaysia. When they performed this type of the thread, they put about 50 to 100 threads over a face on the stage. We all got shocked. This type of procedure, student practice, it doesn't have an effect at all. Just imagine by today, if you look at the market trend, I would say the top 5 procedure, aesthetic procedure, definitely the threads is already in the facial thread. I'm sure all of the aesthetic clinics in our area, we already started to practice this facial thread. So it's actually already changed the trend from 8 years ago until now. It become the top 5 aesthetic procedure. So this, I would say, it can be the minor, it can be the major, but still it's the most common practice thread in the markets. So we can move on to the more major a bit is with the thread, with the pulling types of the thread, or a more advanced, a more complex surgical way to use a trocar and cannula types. So the keynotes here, when you want to practice, or for those doctors who want to venture into this practice, you need to know the market needs, what the market has changed. A lot of the clients nowadays, they try to avoid those open face surgery. That is why this minimal invasive procedure become more popular as compared to the major surgery because of the time. So can we deliver this result as comparable to the open surgery? Of course, I would say no, but at least patient can accept the downtime. So the doctor knowledge and the skills also play a very important. So of course, the last part will be the products. No matter what thread you use, you need to know the details of the products, what you're going to do. That is also very, very important. So the market needs, the doctor's knowledge, and the product, the mechanism of each of the product, you should study in details before you use that. So this is the 3 very, very important things we need to know before we start off our practice. So I would say facial thread lifting and rejuvenation, you always need to come back to these words, basic. If you know the basic, much more easier for you to practice in a proper way. So what are the 3 major results from the facial thread? Okay, so if you have done a lot of the threads, I'm sure everyone will have encountered these 3 very important effects. First is lifting or tightening of the soft tissue, the face tissue. Of course, a whitening effect. If you are putting more superficial placement of the threads, you have a more skin rejuvenation purpose. So you have the whitening effect. If you are doing more targeted volumizing, you need to actually repositioning or augmentation of the deeper tissue. So this is the 3 major results that we can get from the facial thread. The long-term effect you follow up with the patient, in terms of the satisfaction, I'm sure patient actually is more satisfied with the quality of the skin texture rather than the lifting. This is what, by our experience, we found that the skin texture, the skin quality change actually much more better than the lifting. So even though when the patient come back follow up, not much of the lifting, but they still quite happy with their skin quality. So this is the three major result. So when we start to do the whatever consultation explanation when to the client, to the customer, I'm sure this is a very important. You have to tell the thread lifting. You have a two stages. First is the first stage, we say immediate lifting effect by what? If you're using the COTS thread with the bars which can hook the soft tissue and lift it, that actually you have the immediate lifting effect. Or the local damage to have a minimal acute inflammation reaction also help in the first stage. So this first stage usually lasts about 6 weeks to 8 weeks maximum. So whenever the thread lifting, immediate effect, when no matter how high you lift, how good is the lifting, I always tell the patient, you always need to tell the patient, this is not the final result. They are not sustained in this for about 6 months, a year. Usually lasts about 6 weeks. You have to tell them the truth. But what the effect we need actually is a stage 2, the later part when the collagen genesis come in. And then, of course, with this minimal damage and the minimal inflammation because of the thread inside as a foreign body, it actually will increase the metabolism and the blood flow. So it causes a lot of rejuvenation and collagen genesis as a stage 2 to cause the skin more tightened up. So if you have this type of explanation to your clients or your customer, you won't end up with a lot of issues. So never create a false impression to the patient that the thread lift can use to pull all the sagging skin upwards. So I always tell the immediate effect is not the final effect. What we need actually, both first stage and then the later stage is the rejuvenation and the skin tightening with the collagen genesis. So how are we going to classify these threads in the market? I'll talk about more absorbable threads. So there's a lot of classification, all depends on what you need. So starting from the beginning, of course, we have the monofilament. And then one monofilament come in, we have the existence of the COTS, we call the COTS threads, which can hook the soft tissue and lifting. So based on the direction of the COTS also, we have a unidirectional, bidirectional, and multidirectional. So what is a problem with the unidirectional? I see in the market now almost a discount because unidirectional at the beginning, it will cause a lot of migration issue because one direction, the facial movement, muscle movement itself, the thread actually will start migrating. So it comes with a bidirectional. But long-term use of the bidirectional, we also facing some issue. If you are not putting the hooking the threads, the bars on the proper area, so it might cause the migration as well. So at the end, you look at the majority of the threads in the market now, it comes with the multi-directional just to prevent the migration issue. So if some of the thread, the monofilament, you can twist together to give more the volume. So we can twisting of the threads. Cause design also very important. So at the beginning, I think still got a lot of the company having the cutting method whereby you by creating the cuts and heating molding. And of course, I think the strongest will come to the ultrasound molding threads. Okay. The length of the thread, we have the long, short, medium. Shape of the needle, also we can differentiate. Some with the cutting sharp needle, which can cause a lot of trauma. But of course, it's good for those fibrotic tissue, the thicker face skin, or for the male as well. But now majority of the what is so-called thread, it comes with the blunt cannula, which actually will avoid a lot of the bruises and then much more easy to practice. Of course, the number 7, I think is quite common now. Everyone to know the ingredient itself will differentiate all type of the thread with different brand name. So PDO is the most common. Now everyone is upgrading to PLLA, all the mixture of PCL, PLLA with the HA, etc. So you can classify the thread whatever as you like. So this is what we know as a multi-directional, and this is a bidirectional. with the different type of the cannula, you can differentiate as well. This is a molding, and then this is a cutting thread, and then depends on long and short. So in my practice, I classify the thread usually based on the indication. If the patient comes mainly for rejuvenation, of course, we have to target for monofilament thread. So I classify the thread based on indication rather than the type of the thread. If the patient like volumizing, what thread we need to use, more deeper tissue, yes, we need to lift it, or soft tissue repositioning, or combined with other aesthetic procedure as adjuvant or support, so or fine wrinkle. If you look at the number 7, the maintenance therapy is always very important during our practice. No matter what thread you put for the patient, we always talk to them 6 months onward, if possible, try to do some maintenance therapy by putting maybe about 30 or 50% of the first session's thread. It will help to actually increase the longevity and then the effect as well. So this is based on the indication I classify in my practice. So some of the important terms we use in the facial lifting. So this is also very important. If you are practicing the thread lift without knowing what is a fixation point, what is a target point or vector or tensile strength or hanging and lifting point, it means you're just simply inserting the thread into the face. So that is only apply for those monofilament. But if you are using the bead thread with the bar, with the cords and the bar, I would say you need to know what is a fixation point. Which part of the soft tissue are you going to lift, and to which vector and target point? So you have to know about all these important terms by doing the facial lifting, not simply just inserting the thread. So to talk about the fixation point, so it only applies for those with the cords, not for those monofilament. So the most common use, I would say, first and second, bony point or as a fixation, or the true ligament. But of course, some of the area when we try to lift it, but the vector, the target point, when we go against the fixation point, they don't have any true ligament. So what we need to do, we have a false cutaneous ligament that we need to target. Or now quite commonly we practicing, we actually create an artificial fixation point by actually have a double entry. Just catch a soft tissue at the entry point with double entry. We actually will catch call as a temporarily artificial fixation point. That actually will help as well. So this is the 4 most common we use as a fixation point. Whether all this is common. So look at this. This is what we call fixation point, where you want to fix your thread. Which part you are going to lift, we call holding or hanging point. And then which vector you are going up, either up or down. Like what Dr. Choi's technique is a bit different, reverse technique. So that also helps a lot. So aesthetic indication of the facial thread. So what we can do for the thread for the aesthetic practice. Now, whatever things you name in the face nowadays, we can practice for the thread by using the threads. So it doesn't mean that I'm sure a lot of people still the misunderstanding thread only for lifting. But in our practice, I would say all these indication we can target by using the thread, of course, not by single type of the threads. So look at the forehead, the brow lifting. I'm sure the thread is really promising. I think in the evening we'll talk about this brow lifting. And then the fine wrinkle, you can use a monofilament. Periorbital crawfish, yes, we can use monofilament thread. It will target as well. Mid-face, of course, nasolabial fold is the most commonly used. Either you can put the monofilament basically for volumizing, or you can pull the deep tissue repositioning, also will lighten the nasolabial fold. I'm sure the nose augmentation nowadays, people quite familiar with the thread, nose thread lift. You can combine with the filler as well to have a more 3D effect, more lifting feature by combine with the thread with the what is so called the HA hyaluronic acid. So lower face V-shape, lip side, marinate, jawline reshaping, also the commonly practiced by using the thread, double chin, and then the neck wrinkle. All these indication actually we can use the facial thread. So by using these apps, this is a common apps I use during consultation. Even my consultant as well, they use to consult the patient by changing their face to about 70 years old. So if this 70 years old face, we put all the thread what we name all over the face. So can we actually change this face to this face? I would say no. So how we do the consultation, we always tell them start from the age of 30, even 20 sometimes, but usually 30 onwards. We start to consult the patient that if you have the young face today, you can start to do your thread, but depends on indication, either for lifting, for rejuvenation, so that at the age, you don't, by the age of 70 or 60 or 70, you don't age like this. It actually will slow down your aging process. This is how we say thread lifting, not meant for the aged patient only, but of course for young as a maintenance so that they can age slowly. So of course, when you want to practice the thread, the facial anatomy, you really need to know very, very detailed. So I strongly suggest all the doctors should attend at least once or twice the cadaver anatomy courses to know all the important structure of the face before you start to practice. Don't simply insert without any anatomy knowledge on that. So some of the retaining ligament, like what we told earlier, as a fixation point, you should know as well. So what are the complications and the side effects? Now we talk about complication and the side effect of the facial thread. I would say this is very important. We do create the complication or create the problem and then to treat. The better is to prevent the complication, means you better do to avoid the complication by knowing from the basics. So we try to avoid the problem, to create the problem, and then to treat the problem. So I will use the word solvable issue arising from the facial threats because it's not the side effects. So the top one still come with the dissatisfaction or no result. This is very, very common. I'm sure all the doctors who practice for some time, they always will tell you there's no result. Patient will keep on complaining all this dissatisfaction. And then stiffness, bruises, hematoma, all this actually is very subjective. Skin fall and irregularity, protrusion of the thread. Let's go for this part one. So the patient expectation versus doctor expectation is really important. I'm sure majority of the customer walking, you like to use their finger to pull their face upward and show, I want this type of facelift. That's from our aspect, I will tell you, usually it's not possible to do that with the finger and the thread, totally different. So you have to tell the patient the truth, what you can deliver to them. Either part one, first stage, lifting, lasts maybe for a month or two, and then the second part is a rejuvenation part. So the patient selection and indication is really important. Don't ever select a 70 or 80 years old to do the thread to expect to change to become 50 years old. You need to combine maybe with the fat grafting with other mortality. So that is for sure. So the patient selection indication also very important. As we as a doctor, the assessment part must be the straightforward. So improper thread selection also another issue. not because you have a lot of this thread, whether it's indicated with this thread, this type of thread or not. You just simply want to clear the stock and put it in, you will end up also a problem. So very, very proper selection of the thread, the patient also important. Of course, the technique and the skill. So all these actually play a very, very important issue to avoid this dissatisfaction or no result. So the right objective, right patient group, right product, and right technique. Always this is a 4 important point. So clearly understanding the relationship between the aging and the threat. So all this must be practiced. So if the patient come back with the stiffness or too tight of pain, first thing we have to always talk about whether there's an infection or not. So always think of the infection first point must be ruled out before you talk about others. That's why during the procedure, the sterilization is really important, must be done under sterile condition. So sterilize glove and then disinfect the whole area, don't touch here and there with the thread. Okay. So of course, this is what actually we had encountered. So patient with all these thread were done in the non-proper center. So with the mycoplasma infection, multiple with all these unapproved silicone threads. So we have to try to avoid all these complications. Bruises, of course, we need to avoid also, but means you have to know the anatomy very well. If the patient is taking some of the aspirin or the blood thinner medication, try to avoid to stop them about 3 to 5 days before the procedure. The tumescent is really important, play a role, a very important role in the thread, not to numb the face, but also reduce the bleeding, because the tumescent, the adrenaline effect actually will reduce the bleeding, the chances of bleeding. That is the reason why even some of the thread, the procedure is not really painful, but still I will inject a bit of the tumescent to make the face fully numb and reduce the chances of bruises. Skin fall or rimpling, later we'll talk more detail why it happened. Either it's a different placement on not the right plane you have put it in, or insufficient threads can cause all this. Too much of the pulling force also can cause a lot of this. So when you do the thread procedure, make sure you do it without tension, slowly, know which plane you are going, what tissue you are targeting, how much of force you need to pull, not pull as high as possible, especially when the patient is lying down, the face already lifted by 30%. There's no point for us pull until tight. When the patient sit up, it looks like aliens. So this is a very important point. Just pull and then adjust your tightness. So the thread migration protrusion, that's why I say now the unidirection thread already almost is a discount. So the chances of the thread migration is quite minimal. But of course, some of the PDO threads, because of the long-term storage, it might break. That it also can cause the migration issue. So how are we going to manage? Some of you show you some of it. The depression, limping, and then irregularity. So this is what we are practicing in our center. We call as a biofiller. I think this biofiller is really works. If the patient come back irregularity after a month, let's say patient can't follow up within a few days, a week, they come back after a month, what are you going to do? In the few years ago, I like to use a HA filler to fill it up, but I think it's not the right way, because most of the HA filler, it lasts about 2 to 3 months, 2 to 3 months. Even though without doing anything, this irregularity will actually dissolve by itself within also almost the same, about 1 or 2 months. 6 weeks is the maximum. But some of the patients, they cannot wait. So what you can do is you can use a biofiller. Biofiller means you just need to draw the patient blood, 10 ml, you spin down, get the serum, and heat it up for 70 degrees, and then for about 10 to 20 minutes. Use a 3-way to break it, just like a gel, like hyaluronic acid, then you just even it out, because this biofiller will last about maximum 2 weeks to 3 weeks. By the time everything should back to normal. This is a quite cheap and then I would say cost-effective way to do it. Migration, you just need to put a needle. Hydrodissection also will help with 18 gauge needle. This is what we call dimpling must be released immediately or the next day follow up. So a lot of the patients, I would say the doctors as well, like to wait for a month, wait for 2 months. I think the stress is the one that will cause a lot of problem for the patient, not the dimpling. If today you can accept the dimpling and walking around on your face, I would say that is okay. But I think majority of the patient cannot accept the dimpling. So always see back the patient 1 or 2 days. If you think the dimpling is there, immediately release it on the next day. That will be the best. We purposely keep the dimpling post 6 weeks. It's still so deep. We just want to see how long the dimpling will go off automatically. It actually go off almost 3 months. Almost 3 months, just imagine. So that's why don't leave the dimpling there, make the patient too stressful. So release it within a day. So all this dimpling, very easy. You just need to do the subcision. Show you a simple video how we do the subcision of the dimpling. Put a local anesthetic at the area. Use the 18 gauge cutting needle, short needle. So just release it, release the area. So the dimpling at the incision, at the entry point, only you can do the subcision. Listen carefully. Not the middle part, not the exit point. So for entry point, subcision works very well. The other parts, I tell you what you need to do. So this is another one. So this is subcision by using cutting needle. So some of the cases, if we put not enough the thread, you will get all this irregularity. If the patient only affordable for a pair or 1 thread on each side, I'm sure you will encounter a lot of this irregularity issue. So what you need to do, basically not to push or pull down to even out. You should insert more thread in actually to even out the whole things. This is what we call immediate after the correction. By inserting another pair in, actually it can even out much more better. So not all the threads when you put in because of irregularity, we just pull it down. It means that this is not enough the thread. You can insert the second pair of the threads. So you have to assess the patient properly, see what you need to do. This is an over traction to cause all the irregularity. This is a case that the over traction means you really need to push the whole soft tissue down, but not in the easy way. If the patient comes back about a week, you need to inject a bit of the local anesthetic all along that, and then using the force, start to push from the insertion part and then downward. Not the pulling, keep pulling at the exit point. It doesn't work as well. That's why you need to start to pull from the insertion point to push the soft tissue step by step going down. Only you can even it out. This is the tips. Okay, so this is over pulling. So never over pulling to cause all this issue. Even though patient come back a week, you still can manage to do it by inject a local anesthetic and do it. This is the best LED light. I'm sure most of the center, you do stand by this LED light. It works really well. All our procedure with any pricking, needle or cutting procedure, we'll put the patient on this LED light for 1 day to 3 days or 5 days, depends on what patient need. Patient want to come back any day, just put it on. It will reduce the swelling faster. So ice pack also can be done, but post-op procedure, very important few things you need to avoid. Just tell the patient, don't massage the face Never massage the face at least for a month. I always advise the patient at least a month, and then must put on the plaster. Later we show you the plaster, the transparent plaster, if possible for at least a week to support, so you can get a very good result. Because the post-op management is much more important to make sure your threads really works longer. So it's not how good's the immediate result. What we need is a post-op. You have to advise the patient in the proper way so that whatever procedure you had done, actually it really works. Okay, so what are the five key factors when you want to practice this thread to make your threads more successful? I'm sure when no matter whoever walk in to consult for the thread, few of the very important point they keep on asking: pain, whether the procedure is painful or not. So this is usually the first question we analyze. 10 cases, I'm sure 9 or 8 to 9, they keep on asking, is it painful or not? So if you can manage the pain in proper way, during the whole procedure, patient don't feel much of the pain. No matter how frequent you repeat the procedure, patient will agree. If you can deliver a super good result, but patient suffering with tearing, you ask them to repeat after 3 months, they'll say no way. So the pain management is really important, not only for thread practice, but of course for all other aesthetic procedure. So what are the second point? Patient will ask, what is a downtime? Can I work the next day, next week? How long I need to stay away? So this is also important. That's why if you look at the previous thread as compared to the current market trend thread, I tell you, it all changed. We need to practice the thread in that way with the minimal downtime only most of the customer can accept. It's not how good is the end result. It's a downtime. If you are making the patient look like an alien for a month, I can tell you also, they might end up in any of the psychiatric department to consult for depression. So of course, effectiveness, you should deliver the effects. Side effect, you have to explain to the patient what is the effect you are going to get, immediate later effect, what you are expecting. They might have a swelling for the first week or some bruises. All this you have to explain to the patient. The most important is the fifth, proper consultation with accurate information. Never use those false photo with a very good result, V-shaped photo. When we started at the beginning, 8 or 9 years ago with this thread, we like to use all those very impressive photo to show the very V-shaped photo to the patient to make sure they're doing the thread. So tell you frankly, we are really suffering for the first few years because at the end, we don't deliver that result. All the result only lasts for about 6 weeks. So a proper consultation always tell them that is the effect of what is so-called immediate, what we are expecting later part. So a proper consultation, very important to make sure your thread practice is ongoing better and better in the day. Okay. So the pain management in my center, of course, here we can use a mild sedation. I've heard some of the country, especially Indonesia, you are not allowed to use, a general practitioner cannot use. So mild sedation, we actually use a Domicon 2 ml and then with the ketamine, diluted ketamine. And then nerve block, you can use it, tumescent infiltration. Of course, this tumescent basically for the post-op pain, you can relieve the post-op pain. Post-operative analgesic you need to prescribe. Of course, the supportive plaster and the facial bandage is really important for the first week. So that all the soft swelling gone down, is really fixed the thread, then it never sat down at least for 6 weeks. So this tumescent, you can mix your own. So this is what we call the bandage, facial bandage, mask bandage. It's commonly used, but of course, patient cannot walk out with this bandage. Quite difficult. So you end up with using this Tegaderm film, which is a transparent. So at least a week they need to wear it off. So don't create all this out of face and then send the patient off. How much can your client accept this out of downtime? No way. Okay, now let's touch about the combination technique. So quite common, I'm sure the toxin and PDO threads or any thread, not going to talk about only PDO, any threads you can use toxin with any threads. So when you talk about toxin, I more prefer if the patient stay around with you, just put the toxin 2 weeks before the threads is the best. Filler, I would say you can put the thread first, then filler later. If you want to do it in the same setting, can? Yes, can, but different layer, definitely. Fat grafting is the best if you can put in the PDO thread, whatever the thread, as a supporting, supporting for the fat tissue. Okay, so PRP is very common we practice with the thread together, lipolysis, PDO. HIFU and the PDO, I would say HIFU and the facial thread, always do the HIFU at the same day you can do the PDO. But once you do the threads already, if you want to do the HIFU, you should at least 3 to 6 months later. I more prefer 6 months later. So do the HIFU first before you do the facial thread. It's okay. Combination thread is always nowadays the market trend. You can combine PDO, PLA, PCL, all the thread in the whole face, depends on what indication you need. So this is a periorbital rejuvenation by putting the PDO threads and then erbium laser, if you're using the photona. So you can do the tightening effect. Okay, same way. So not only the whole periorbital area we do it, so you can see tighten up and then tighten up all the periorbital region. PDO or any thread with this one PRP as well. Okay, and then HIFU, and then you can see there's a sharpening, tighten up. So always do the HIFU before the PDO thread. Fat grafting is the most commonly we use. So we do, when you put in the fat, you need some thread to support it so that the fat actually will stay at that area. So PDO thread with the fat grafting. So if you use a multi-combination aesthetic procedure, like this type of face, you want to use a thread to slim down, I can tell you it's not possible. So what we do is do the chin and lower face ultra Z lipolysis, minimal surgical procedure to remove the fat and then put in the threads. And then, of course, you still need to inject an alpha-choline lipo injection to dissolve some of the area. Of course, this type of the patient, you need to ask them to go for the slimming program with the oral medication. So you then only you can see the whole difference. There's no single modality treatments why you have to combine with all the medical treatment. Same way, this one, the neck, we do it for the power-assisted lipolysis to actually melt the fat, and then we put in the thread also, nose thread as well, chin, we put some the filler on that. So this is what we get immediate result. Immediate result, you can sharpen the face, and then nose, of course, we put the nose filler thread, and then the chin, we put in the filler to make the face more longitudinal. So actually the thread you can combine with all other aesthetic procedure as well. So same way, neck and lower face, we do the lipolysis and then suck out all the fat manually, and then we put in the pyramid PDO thread to pull it up, tighten it up to the side, and then this is what we get even 3 months later with the double chin all gone and more sharpened face. So are we still using the term lifting? I would say if you are practicing any thread, I like to use these two terms. One is the internal, one is the external rejuvenation, and then I try to use the word tightening effect. It's not the only lifting anymore. So for all the face, I would say face tightening by using the threads. It's not the lifting anymore. So this is a few message I would say. If you want to practice, always have to practice with a minimal downtime, which a patient actually can accept. Less side effect, you have to tell them the truth. What is the short-term and long-term effect? Of course, internal and external rejuvenation. Okay, thank you. Sorry for the long talk.
Thank you very much, Dr. Lan. So now we come to the session for question and answer. To all the participants, please write down your questions in the question box, and then we will discuss one by one. We have already here from questions from Dr. Yanvi to Dr. Lan. What is the most common side effect of thread lift? and how do we avoid this as practitioner? Please, Dr. Lan.
Okay, that's why I say there's no side effect. I would say not we don't use a side effect. We use as a complication, all which is avoidable. It's all because of the skill issue. It's most common is irregularity and the rimpling. That is the most common part. I think majority of the cases, even though we do the training for any of the cases, at the end, a lot of the doctors comments back is that they comment patient come back to complain because irregularity, dimpling, all these issue. So I wouldn't say this is a complication, but this is a skill dependence. So you should know which plane you are going in. Fixation, hanging point, all very important. Never over pull. If you over pull, you cause all this issue. Second point that we have seen commonly, second common issue is that it's infection. That's why I would say don't simply touch anywhere. You really have to clean with the povidons or alcohol, the spirit. That is usually I practice povidon plus the 70% alcohol. Clean up all the hair area. Make sure there's no hair going into the trap zone. So this is the two most common don't say cause side effect, I would say complications. So if you are practicing the proper, you should can avoid it.
Okay, thank you. And then another question from Dr. Vera. What is the direction in adding another pair of threads to treat the irregularity? Please, Dr. Lan.
Okay, if you look at just now what we, because very subjective, if you look at previously what I show you the slide, the patient have a quite deep, too high pull up dimpling. So what we need to do is the thread should pass across that to make a support. So if you put two thread over there to cause a bulging in between, mean there's not enough thread in between. So you need to add on another in between to make it tighten up. So all depends on your assessment how to put another extra thread in. Yeah.
Okay, okay. And then we have another question again from Dr. Ubeta. How long the dimple and irregularities will disappear? Maybe this means if we do not do anything after insertion the thread.
Very frankly, during the entry part, it really lasts very long, at least 3 or 4 months or sometime. Depends on how superficial you catch the cutaneous layer. If at the middle part or the exit point, usually it lasts for at least 2 weeks to a month, 2 weeks a month. But entry point always is a longer period. So I strongly suggest to release it within a week. Please release it within a week. Of course, a lot of practitioners will advise a patient, don't worry, actually it will go off by itself within a month. That is true. But I think the whole months are really stressed out for the patient.
Okay, thank you. And then I would like to ask about what do we have to do to prevent the bruising and swelling. You mentioned about using the plaster. I think in Indonesia, we've never used kind like the plaster. Could you please explain how patients use that and where can we get that plaster?
Yeah, the plaster is under 3M company, the Tegaden, as shown in the slide. I think the worldwide is available. It's a transparent plaster. It's very easy to use it. You just need to plaster on one side, plaster on the lower part, pull slanting upward and stick it. Actually, it's a transparent, totally transparent. Totally transparent. So patient actually for first day, if with and without, patient will tell you very frankly, with the plaster, the pain is really less and then the swelling also reduce faster. So the next day, the patient need to peel from the lower part upward, then they need to change another plaster, pulling upward and stick again. Actually, it's a transparency.
I see.
Yeah.
Okay.
Better than you use a bandage. Bandage is not convenient for the patient to go out.
Yeah, I see. Okay. That will be better. Again, for dissatisfaction for and no result for patient, yeah, this is to be a concern for all doctors who do thread insertion. Yeah, so we have to very careful do selection for patient. Yeah,
Yeah.
Dr. Lan. Yeah,
Yeah.
and informing the patients at the first time before we do the treatment is important also. Okay, we've got another questions now is from Dr. Ubeta. If there is any infection, should the thread be pulled out or just treat using the broad antibiotics? What do you think, Dr. Lat?
100% you need to take out the threads. No matter how strong the antibiotics you start on for the patient that we had encountered a lot, some of the cases were referred, no matter how strong even the IV injections, actually the infection will keep on recur. It might have a infectious foci inside, look like it's already subsided. If the patient long term, let's say after a month or two, it might reinfect again. So I strongly suggest, no matter how, if there is an infection along the line, please remove the trap. Don't treat with antibiotic. You can remove and treat with the antibiotic, but without removing the trap, treating with the antibiotic definitely is a wrong practice. That is what my experience. We have managed a lot of complicated cases will refer. I've seen no way without removing the trap. So you have to remove and then start on the antibiotics.
Okay. What about if there is any if there's any protrusion of the thread and there's no sign of infection? Do we keep the thread or do we have to pull the thread?
Oh, good question. So whenever there is a protrusion, let's say example, there is a protrusion. So try to open a small hole with the needle, catch the thread, protruded thread, try to pull the thread and see whether the fixation point already loose up or not. If the fixation point already loosened, you can pull, please pull out the whole thread. Don't pull a bit and then trim again. If you trim, means the fixation point already loosened, it will migrate down again. Maybe after 2 weeks, patient will come back another protrusion. So my suggestion is always try to pull and see whether the skin is moving. If the whole skin is moving and then the thread is not moving, means it still fixation is there. So you just have to trim it shorter. No need to remove the thread. Yeah.
Okay, thank you. Okay, another question now from Dr. Julia. How long should we use the bandage? So this is talking about the bandage again. And take Guarderm for supporting after the thread lift. Please, Dr.
I always ask my patient to put the bandage for at least a week. Some of my patients, they do put for more than 10 days. So all depends on the patient. But 1 week is the must for all the swelling to reduce and the fixation to take place. So 1 week is the must. So patient can change themselves. If they are working or traveling, but now I'm sure no issue for those because most of the patient is wearing the mask. They don't care. So you can put the plaster. So majority of the patient, let's say daytime, they cannot put the plaster, is still acceptable. But at night time, make sure they really put on the plaster. At least at home, they start to put on the plaster. 1 week is the must.
Okay. Yeah. Okay. Thank you. And then about combination, Dr. Lan, you mentioned about combination using HIFU, using lipolytic for patients with big cheek, with big lipo. Yeah. How do we plan the schedule for patients? Do we do the lipolytic first and then inserting the thread, or can we do it at the same time? What do you think?
Okay. For lipo aspiration, we use a syringe and a cannula to suck the fat. That is the same setting we can do together. So we clear whatever the fat cell out, and then at the same time, we use a thread to tighten the skin. So that is can do it in the same section. Lipolysis, I more prefer to do it usually after 1 month. So if you're going to decide to do the lipolysis, whatever the design, the thread that you are inserted, please indicate in the case note properly. Because we will actually target those fat cell, deep tissue fat cell, without the thread. Because we don't know the lipolysis agent, it might have some effect on the thread. So you have to avoid those areas that you have already put the thread. So we are targeting only the remnant of the fat cell. We just inject direct to the point. That is a lipolysis. So I don't do lipolysis before the thread because we don't know how long the lipolysis solution effect on the face. If you are doing the lipolysis first, then you might need to wait at least 3 months onward to do the thread. It takes time.
Okay.
HIFU, I will always advise a patient to do HIFU 1 or 2 sessions before the thread. That is for sure. If the patient is from outstation quite far away, you can do on the same day, start with the HIFU first, and then proceed with the thread. Yes.
I see. And then what about combining that with the PRP? Do we have to do PRP first or PRP after the thread? What do you think?
I always do it after a month. After a month, actually it helps a lot. So there's 2 ways to do the PRP. So first you can put the threads and then you do the PRP. The face will feel really swollen. That's not the most of the patient want the effect. So what my common practice was when we put in the thread, we will actually consult for the PRP for the next session 2 weeks or 1 month later. We actually will increase the healing, first thing. Second thing, of course, the growth factor in all these PRP will help for the collagen genesis as well. So we do in our center is 2 weeks to 1 month after the thread, we do the PRP. Yeah.
Okay. Okay, thank you very much. Yeah, I think there's no other questions in question box, and I think we already have lots of discussion about the technique, the basic technique, and preventing the the complications from thread lift. Yeah, thank you very much, Dr. Lan, for all sharing your experience about using thread. Please give some take-home message, some conclusion for all these participants, doctors, please.
Take-home message again, know your procedure well, know your product well before you practice. And then I still think for the tracks, it's really a long journey to learn, not a single training or practice, you will know it. I will strongly suggest for all the doctors, no matter where you're from, do it in a group practice. Group practice means try to share more of your experience, your complicated cases, and then learn from other colleagues. So the more you're sharing, the faster you master your skill and this is a threat issue. What people make the mistake, you try to avoid. And then we will try to share what the mistake we have made for the past 8 or 10 years. So this is how you should learn. The more you share, the more you learn actually. So take home message, I would say practice more to master your skill.
Okay, thank you very much. What a great presentation, Dr. Lan Yung Chung. So everybody, this is the end of this morning session. This is already afternoon, and then we still have another session this afternoon. Don't forget. So you may have a break after this, and we will be back later. Once again, thank you very much for Dr. Lan Yung Chung. Success always, Dr. Lan. Stay safe, stay healthy. Next time we'll meet you in Indonesia after pandemic end. Okay, thank you everybody. See you later.